CBS Mornings. I'm Gayle King. Coming up in this hour, how reliable are those COVID home tests anyway? We'll hear from a scientist who makes sure the results are correct and claims that the new CDC guidance for COVID patients is reckless.
I'm Tony Dokoupil. Dr. John LaPook will show how a dancing program is helping thousands of people fight off the effects of Parkinson's disease and could help millions more all around the world.
And I'm Burleson. First on CBS Mornings, James Corden talks about big changes he made to improve his health and celebrating 1,000 episodes at The Late Late Show.
Go James Corden.
That's right.
First, here's today's eye-opener at 8.
Are your patients younger kids or your teenage kids that you're seeing?
Unfortunately, we're still seeing both. We've had some babies that were a few weeks old.
The FDA approves COVID boosters for 12 to 15-year-olds while hospitals fill up with even younger patients.
I just sat there and I cried because I didn't know what her fate would be like, if she was even going to make it.
Travel chaos continues across the country after a powerful snowstorm pounds the mid-Atlantic.
Temperatures are below freezing. The ice beneath my feet is slippery, and all of those conditions will have an impact on how travel nightmares play out today.
The first investigator of the January 6th assault on the Capitol says rounding up everyone responsible is a mammoth task.
So are we years out from seeing the end of these cases?
It would not surprise me if there's cases charged in 2022 or 2023.
A jury finds Elizabeth Holmes guilty of defrauding investors in her failed blood testing company, Theranos.
I could have gone into detail about how the technology didn't work and the various ways the technology didn't work.
And a man discovers an 8-foot-long alligator in his driveway and convinces his neighbors to help remove it.
That's good friends. You can call them to help out with that project.
Nope. You better call somebody else.
Yes, you better call.
I'll look up some numbers for somebody else you can call.
I'm going to call that dude in Florida with the flip-flops.
With the flip-flops. And we'd like to think we're good neighbors, Nate. We'd like to think, but I ain't doing that. Welcome back to CBS Mornings. We're going to start this hour with a stunning moment in the pandemic. More than 1 million new COVID cases reported in this country in just one day. The number of children, thank you, Patty, the number of children taken to the hospital is also rising. The CDC reports an average of 378 pediatric admissions a day last week. Now, that's up 66% from the week before. Yesterday, the FDA authorized Pfizer booster shots for 12 to 15-year-olds.
That's right, Gayle. And if the CDC approves, up to 17 million kids could start getting boosters by the end of the week if they got their second dose of vaccine at least 5 months ago. The FDA also authorized a third shot for some children ages 5 to 11 years old if they have compromised immune systems. Here to talk with us about all of our latest concerns when it comes to the COVID rules, epidemiologist Dr. Michael Minna. He's the chief science officer at eMed, a biotech software service company that enables authentication of at-home tests for public health reporting. Good morning. How are you doing?
Doing very well.
Good. Now, we know that you believe boosters for kids, that's the right move. But why is that important right now?
Yeah, we're seeing pediatric hospitalizations increase. And in a country like ours that has an abundance of vaccines, as long as we have decided that they're not going overseas and that the best place for those vaccines is here, then getting these into individuals who remain unboosted and still vulnerable to variants like Omicron is very important right now.
You know, Dr. Bennett, so many people are confused about so many things. Hopefully you can sort some things out for us. Let's start with the CDC's new isolation guidelines. You have called them reckless because they do not require a negative test before you get out of isolation. A lot of people agree with you on that. But the CDC says that they don't ask for the test because people can still test positive for up to 12 weeks. And they can test positive, but they're no longer infectious. That's an important point to make. They can test positive, but they're no longer infectious. What do you make of their response to that?